Hi, I'm Mike Carberry, and I'm a chiropractor.
And I'm Coleen Carberry, and I'm a physical therapist.
And we are the founders and owners of AMI, Advanced Medical Integration. So it's been a long journey to get here. We've been working together. We've been married for 38 years. We've been working together probably for 32, 33, something like that.
Yeah, totally.
So I guess I started the practice in September of '92, and by myself I was able to build it to 100 visits a week. I did that in less than a year. I did it in less than 6 months, I think.
Yeah, I think you even had 2 employees.
Yeah, I did.
Yeah.
And but I needed help, and I was new at employees, and I was new at payroll, and I was new at insurance billing, and I didn't know any of it. And I was kind of a little over my head, and I was trying to do patient care. And so you were working. You had a job. You were self-employed, but you were working as a contract PT.
Yeah, yeah. So during those years when you were in school, obviously I worked as a physical therapist while you were in school. You did some side jobs, and then you were an associate and opened your practice. But I just consistently worked as a physical therapist, which was great because I could make a good living.
Yeah.
And you're right. That last year, I did contract work, which I felt like I was a little bit more self-employed at that point. But I did contract work to bring income into the family. But you opened the practice, got the practice to 100 visits. I kind of did my PT work. We had Amanda. She was little at the time. Remember, so she was probably 3 at the time, maybe 3.5 at the time. We came from being super poor when you were a student to like finally actually, we bought a house, and they felt like we were getting going at that point.
Yeah, we bought that house in 1994, I think.
Could be.
Yeah.
Yeah, could be.
Because Lauren was born in '94.
Yeah. Could be. But we thought we had our track. Like you were going to open the practice.
Then you were going to come along. You were going to keep the income coming in. It was our golden handcuffs. We had that steady income that kept us supporting what you were doing.
Yeah.
But I think we both had a realization about the business.
Yeah.
And I know my realization was that it had potential, great potential, if I had help.
Yeah.
And you were the person I trusted the most, still are.
Yeah.
And I wanted you to come in and work with me full time and put the physical therapy aside for a little bit.
Yeah, and that was hard. I think it was hard. I think those couple of weeks when we had discussions about that, because you're right about that. We had a steady income, which is what was paying the mortgage. And again, you were a student for many years, and we lived on a very small amount of money, knowing that one day you would be in practice and that you would have a big practice. That was always our dream.
Yep.
The dream never really had me written into that practice. You know what I mean? It had me more like we would have kids, maybe I would stay home, maybe I would keep working as a PT. But you're right, you came home and we were the discussion started, does it make sense to put aside the physical therapy, the consistent income, the certainty of the income, to take the chance to work together. Yeah.
So we had to come up with a way to get the practice to build.
Yeah.
That meant getting new patients in the door.
Yeah.
And there was no digital marketing back then. There was no internet. There was no, Instagram and LinkedIn and YouTube and Facebook. Yeah. So we were doing grassroots marketing, going out and getting people, getting referrals. We did active referral campaigns. But I remember I got an opportunity. One of our patients that came in was very happy with his care, and he worked for a very famous garden, Longwood Garden. And basically he wanted me to come in and speak to all the students there. And I thought, well, okay, here's this being plopped on my lap. I wasn't the best public speaker. I was actually very nervous about it. But I said, sure, I'll do it. I had no idea what I was going to talk about. I remember I had to put slides together. There wasn't even any PowerPoint back then. It was slides. I had a slideshow where I think I used acetate overheads.
Yeah.
And
I don't remember. What is that called? The machine that you put this, you change out the...
Well, the slides were in you had a deck, and we put slides in.
We're showing our age.
But I actually, it was, I put together a program. Yeah. And I went and spoke, and I was talking about the dangers of surgery. And I remember I was there was 32 students in the room, and they were all there, and they were all like on the verge of starting their career. And I remember walking in and saying, so, I'm talking to you about the danger of surgery. Why would a chiropractor talk to you about the danger of surgery? And somebody in the audience yelled out, for money. And something happened to me. I don't know what it was, but I got like fire in my eyes, and I said, you're darn right it's about money. And I started going off about how expensive surgery was and how
Yeah.
inexpensive chiropractic was and how effective chiropractic was and how surgery was just treating the symptoms and chiropractic was treating the cause.
Yeah.
And I closed 28 of those 34 people, or 32
That you did,
people.
didn't you? Yeah, that
which,
you did.
Which they all went on a 3-time-a-week program. We went up by almost 90 visits in 1 hour.
Yeah, yeah, that's phenomenal. Absolutely, that is what happened. That is
Yeah.
what happened. You know, it's interesting because when I came and joined the practice, right, it was, again, we spent time talking about the pros and cons of leaving a steady income to joining the practice, right? Because there was no income then.
Right.
And so when I came and I joined, probably a week or two before that talk, you know, it was kind of like on a let's give it a try and see what happens, because we had a little child at home and I was newly pregnant and we had a mortgage to pay, and the practice certainly wasn't making enough to support that.
Yeah.
And so it was like, let's give it a try. And so for me, when that fire and that passion turned on, you know, I was traditional. I came out of the traditional medical system, traditional
Right.
and traditional medicine, and here I am, right? Okay, we're building a practice. Okay, you know, what I knew about practices sounded fine, right? But then all of a sudden, like that passion turned on of it, and even then, as a physical therapist, I had to wrestle with everything that I knew and I was used to. So, you know, just like a lot of couples that when they come together to actually practice together, they're both coming usually from two different worlds,
Right.
and they have to figure it out. And so we definitely, it took us a couple of months to figure it out and to kind of align to figure out, you know, where are your talents and where are my talents, so that
Right.
we weren't just literally stepping all over each other, which, you know, sometimes I've talked to clients in the past, and that's the biggest issue, is the husband and wives are all over each other and didn't figure out their strengths and weaknesses.
We came up with an agreement. I guess it could be called an operating agreement. We didn't sign it. It was just a verbal.
Yeah.
But we respected it. We had agreements on who had the final say. We had the tiebreaker agreements.
Mm-hmm.
At home, you were the tiebreaker, and in the office, I was the tiebreaker.
Yep. Yeah.
I realized very quickly after doing that talk and going up by 90 visits in 1 hour, that was a great way to increase the size of the practice. And back then, chiropractors measured their success by a lot of it by the number of people they saw.
Yeah.
And so that's what we started doing. We started saying, how can we increase the number that we're seeing?
Yeah.
And we got to just about 200 visits a week. And then I thought, well, I'm never going to pass up a chance like that again. So we started creating chances. And I remember
Yeah.
we would go to libraries and public places and hold talks about headaches and hold talks about whatever.
Mm-hmm.
And go and do screenings a lot. And the screenings were, first we were doing like posture screenings.
Yep.
And people were actually interested in that. I was
We'd go to
surprised.
Walgreens, or we'd go to CVS.
I
and
remember
they'd do
going to
blood pressure
a
screenings.
place called Ames.
Oh yeah, I remember that.
And
yeah,
it was
yeah,
like
yeah.
like a low budget Kmart. No offense to Ames, but
Yeah. Yeah,
or
that's
to
true.
Kmart.
Yeah.
But we were going there and we would sign people up. People
Yeah.
would actually be interested, and I would remember I'd go on a lunch break for 2 hours, and my goal was to sign up 6 people in 2 hours.
Yeah.
And I would usually do it.
Okay, so here, this was a successful action that we did. Was we weren't random about this. Like the one thing, when you did that Longwood Gardens talk and you got all those people who went up like 90 visits, right? It was like a jump. Now that with going from 100 visits to 190 visits brought its own complexities. We had to hire people, figure out the insurance billing. Like there was a lot that went with it. But put that aside, you know, their business can jump and then they drop right back down to where they were.
Right.
We got the taste of, wow, an impact. Like we could go do something and cause that impact. And the one thing that I think we did so right back then was we got such a high off of that jump
Yeah.
that we looked for the next thing. So what we did was we filled the calendar, like you did, because your job was the marketing and sales,
Yep.
right? And I was doing the, you know, HR, insurance, the finances, you know, not really over clinical so much, but as a PT, I completely understood all the notes and stuff like that, right? So you were more over the clinical and then over the marketing and the sales. And so
Right.
we had the company split well, but I think more importantly was not only were we aligned in what we were doing, but we were constantly going after that next event,
Yeah.
and you're right, it was workplaces, it was Ames or wherever we went, right?
It was public spaces like
Yep.
libraries or places like that we can go and speak.
Yep. It-
I remember it got to the point where I said, I can't keep setting these places up, do the treatment, do the
Yeah.
delivery,
Yeah.
so we
Yeah.
hired a marketer. We hired somebody
did.
to just, and
Yeah.
we had a couple false starts with that. We had a couple people that we thought were going to be good and
Yep.
turned out not to be good.
But we went back at it. We just kept at it. I think
Yeah.
that was the successful action was, even if we hit our knees, we stood back up. And probably more importantly, and this is like, to me, husband and wives working together, is when you're aligned, right? And you're both going for a common goal, because you got a common goal, which is the family, the children,
right,
the marriage, and the business. You know, it's not like I'm off working over here, the kids are in daycare over here, you're in business over here, and every day we're like this, and we come back together for a small period of time. 24/7, the whole children, everything was pulling in one direction.
Right.
And with that, what we found, which was I also think is another one of our successful actions, is when one of us went down for whatever reason, like if I had a child, you literally covered everything.
Right.
So the business never missed a beat.
Right.
Ever missed a beat. And so if something happened to you for whatever reason, say you had to do events for 3 days or something and you weren't there, whatever, I covered. And I think that we had each other's back is also the reason why we just went boom, 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 boom up, because it looked like there was always somebody pushing, even though sometimes one of us might not have been pushing at the same time. Yeah.
Right. And that's how the evolution of the 12-week marketing plan came about, because when we hired a marketer and we finally got a good one, and we, even with the bad ones, we still did good, because we still got out, and I made sure I got out in front of people. I made sure I asked for referrals when people came in, and I had no associates. It was just me.
Yep.
So we kept pushing that, and then we started saying we need a calendar to keep track of all these things. So we created this calendar, and we started noticing, hey, we have stuff booked all the way into next month.
Yeah.
And then all of a sudden it was like, we even have stuff booked into the next month.
Yeah.
And we realized that's 12 weeks away. That's a quarter away.
Yeah.
And then we realized the target is to fill the quarter with events. And every week that passes, we just move that another week. So we have a 12-week quarter full ahead of us, so we could predict what was going to happen, 3 months down the road.
Yeah.
And that became our stable thing. Our baseline was having this 12 weeks planned out in advance.
Yeah.
And we just kept doing it. And then we changed marketers. We had a lot of marketers over the years. We had marketers in Pennsylvania. That practice grew and grew and grew. I remember
getting to 400 visits, it was, I think we had
I remember going over 300. That was one that stuck out, because we were stuck at like 298.
Oh, I remember that, being totally stuck.
I'm like,
and then we went over.
And I remember offered a bonus to the staff if we got over 300, and if we couldn't get there, we got close. And I remember walking out in the parking lot and seeing 2 people who were patients and say, you and you're getting adjusted right now. And I brought them in.
Going over the 400 mark.
It was over the 300 mark. And we got over 300. And then it was like, I can't believe we did 300. And then we're like, let's do 400.
Well, I want to take you back to the marketing thing, because you said something, okay, which is, that was back in the days, there was no Facebook ads.
Right.
No Google paid ad, no Google words, right? And what I heard you say was, we built our practice off of human contact.
Yeah.
Well, that is no different today. Like, how we built our practice, which was going out and speaking about purpose or your practice in front of anybody, anywhere, anybody can still do.
Right.
We had no money when we started. It didn't cost us anything to get out there and speak, right? Like, the idea that you have to have paid Facebook ads or paid Google to make it is not even true. Like, we made it to 400 visits without any of that. We weren't on TV.
I think the Facebook stuff made it easier, but we never stopped doing that stuff.
Yeah.
Even to this day, we still, that clinic in Chattanooga, we would do stuff to be in front of people.
Yeah.
And we got it polished to the point where it didn't always have to be me. We got other people that could go and do things like screenings.
Yeah, that is true. That is true. But, I'm just totally having an aha moment here. So let me have this aha moment, because I realize that it's in this technical world now with Facebook ads and Google AdWords and all that, it's missing the human connection. It is completely missing the human connection. And so what might seem easier is actually not, because people who are hurting are looking for human connection. And so the simplicity of getting out there and doing talks, even for small groups of people, the word spreads. Your Facebook ad shows up and it's gone like that. And you're paying a fortune hoping to capture somebody at some point in some time that maybe might think at one moment to click a button and might remember 2 minutes later what they just did. Not the case. When you spoke in front of people for 45 minutes, they remembered you.
Yeah. Well, to go along that line, I remember one time we had a great patient. She was a wonderful person, Anita Gerwitz. Remember her? Mm-hmm. And she had a daughter named Yale. And they wanted me to go speak at her school. And I'm like, of course I'll go there. And I remember people saying to me, there's not going to be any patients there. They're all school kids. They're like middle school. Mm-hmm. And I was like, no, I want to go there. And I just found out last year that Yale is a chiropractor.
Really? You never know when it's going to impact somebody. You never know. Yeah, I know. Phenomenal. Good job. Good job.
Yeah. I get a little
Yeah.
emotional because it's my passion. It's been my passion for all these years. And to realize that I touch people like that, we've had other people become chiropractors based on me working on them when they were kids.
Yep.
And it just makes me really proud.
Yeah.
Because the whole idea is this is an art we don't want to disappear. We don't want people to forget what it is. We want people to get that type of service.
Yep.
And get well without drugs, without surgery. And, the more the better.
Yeah.
So it became, that was my drive, to get in front of as many people, as much human contact as possible, because nothing will replace that human contact. I mean, nothing makes an impression like that human contact.
100%. I think that's how, and since we're speaking about going from 100 to 400 visits, right? Anybody can do this. You don't need Facebook, you don't need Google, you don't need anything. You just need to be able to be willing to go out into your community, have passion for what you do, and speak.
Right.
And the hardest thing to overcome there is to figure out how to speak. So look at it this way.
And if I could do it, anybody could do it.
But imagine this, like we got to 100 to 400 visits literally based on that principle, because you just kept going out there and out there and out there and out there. And then as they came in, we closed them onto treatment plans, and then inside I made sure staff was there, and the staff was trained, and the billing was there, and the place was beautiful, and there was coffee there, and I did all that, I get that. But it was the constant push in of the people that actually built the practice. It wasn't any of I could have done all of that stuff and have nobody come, right? It was the constant push in of the people that gave me the opportunity to hire more people and train more people, and it was that momentum. And that is something today, anybody can do that today. You do not need money to go out and do that. Your Facebook ads, to me, are a compliment to what you do. They are not what is done, and your talk the compliment. And that just, to me, revitalized the fun that we had back then, and then the reality that I didn't need to work somewhere else. Right? That the sky was the limit on our income. Once we hit that 350, 400 visits, the sky was the limit.
I remember us having that discussion, going, the sky's the limit. We can make this as big as we want. As big as we want to go, we can get that big. And I remember the thought was, let's get this one practice to be gigantic. And it became gigantic. Yeah. We got over 400 visits. I think we were like 420 or 425 when we started going, I think I need some help on the delivery part.
And then got to 750.
When we hired 2 associates.
28 employees, got big.
I remember Dave Morris, when we hired him, he's like, what's the secret to success? And I sat there. I remember having this conversation with him going, what did I do that was so successful? Because I wasn't even thinking about it. I was just doing it. And it was the answer what you just said a little while ago. It's like when we get knocked down, just keep getting back up. And I remember saying to him, it's like being a fighter that won't stay down. You knock them down and they just keep getting back up. I said, I'm not like some spectacular superstar. I just would keep doing the same thing over and over again until I got hurt, until I got a result. And that is the secret. It
is the secret. And when there's husband and wife teams, the public never sees anybody go down, because one is covering for the other. That is the huge thing, is that one would never, because if a doctor who maybe doesn't have a spouse in the office, it's you get right back, like you get 24 hours to 24 hours is all you get when something bad happens, and you're back up, right? When there's a husband and wife team, not that you should take more than 24 hours, but with a husband and wife team, nobody even needs to see those 24 hours. It just looks like the machine is moving forward because there's coverage.
I had your back, you had mine.
And I remember times it would be like, whatever, let's just say, if you weren't there, whatever reason it was like, hey, where's Dr. Mike? It's like, hey, he's out there building the practice. That's all I'd say. He's out there building the practice. Didn't matter what you were doing, you were out there building the practice, and they were like, oh, because it looked like a united front. If I was not there for whatever reason, you were saying the same thing. She's out there building the practice. So the united front was always there. I think that and we got back up. No matter what happened, we got back up and we kept going, was the secret to our success.
Yeah, it was. And it was fun. I mean, as I sit here and I look back, I got a little emotional a minute ago, but it just touched a chord that I haven't looked at in a long time. And it's just, I wouldn't trade my career for the world. It was like the hardest, most fun thing I've ever done.
So, kind of to end off here, right? You can get to 100 to 400 visits. There's nothing today that we didn't have years ago. There's nothing magical about this. It was fun, and we just did it.
And we looked at one thing I think we did very well, and it wasn't until I heard other speakers say this that I realized we did it, is when we ran into obstacles, because you run into obstacles, we stopped looking at them as problems. We started looking more at them as like, well, how do we overcome this? This is another stair step to get up to where we want to go.
Yeah.
Well, we want to get up there, and there's this problem here. Well, if we get on top of that problem, now we're closer.
Yeah,
And
absolutely.
looking at it that way, I think, really had a big effect on our, like, we just never let up.
Absolutely, yeah.
Yeah.
Yep, yeah.
Well,
Well, that
it's
was
been
fun.
It's been a fun ride, Coleen.
Yeah.
I loved working with you. I still love working with you, and we're going to
Fun
keep
reminiscing.
going. Yeah.
Good, good.
All right. Thanks for listening.